pacing yourself in counselling sessions, Rory?
Yes, absolutely. I think it's one of the most difficult disciplines to learn when you start as a novice therapist, because as I've said many times in the podcast, the opening of counselling is rather like the opening of a theatre. The curtains draw back, the stage is set, the protagonists are on the stage, and then it opens. And how it opens and how we pace the session impacts, I think, on the relationship, how the client feels, how the client can relate to us, and what the client can share. And also it impacts on ourselves. As a tutor, I've seen many novice therapists start off like a galloping horse, or a greyhound, straight out and straight in. So, what we come for today, and this can be overwhelming. It's very important that we learn to go not just at the client's pace, but just behind the client. We should always just be slightly behind the client when they're telling us something, or we're picking up a piece of nonverbal communication. We should just be behind the client, so we're able to kind of take some time, think about what it means. I'm always a great believer in just checking what does this mean, what is happening here, and then considering your interaction or your intervention. And I think it just does take a bit of getting used to. It's a bit like driving a car, really, or learning a new skill. You've just got to really experience it before you could do it, Ken.
Yeah, and we're speaking about therapeutic pacing, so that's within the session. And I think looking at pacing starts with looking at who you are outside of the session. What is your nature? And I'm going to give you an example. When I go for a walk with my wife Colette and my daughter Kristen, they are forever saying, "You walk too fast. You're a very fast walker." I'm a fast walker. I'm a fast talker. I tend to think quickly. I tend to act quickly. It is within my nature. It's how I'm made up. My metabolism is faster. It's just who I am as a person. So recognizing that is me, I then need to look at, how do I present? How do I show up? What part of me do I bring when I show up professionally with a client? Because if I bring that walk too fast, talk too fast, do too quick side of me into the therapy session, then it's me and it's my session, and I'm leading the way and I'm setting the pace and I'm setting the rate at which we're going to move forward. And that is not in service of the client. In podcast episode 201, last week's podcast, we spoke about unconditional positive regard and looking at a client without judgment. And part of unconditional positive regard is recognizing that this is the client's space that we professionally hold. It's not ours. It's not for us to be there to counsel the client. It is more for the client to come for the counseling. So it's just a slight different way of looking at it, but a really important difference when we look at it that way. If we truly do have unconditional positive regard for this client, then it is theirs to lead the session at their pace. And I like what you've said, Rory. It's not about us matching the pace of the client. It's about us being slightly behind the pace of the client. And why? So that the client is leading the session. The client leads the session. Of course, we start off, we need to maybe contract, set the boundaries where we are leading. But as soon as we hand over to that client, it is theirs to lead from that moment on. And one of the greatest counseling skills for working with that is the skill of silence. We do less. We listen intently, openly to this full client, who they are, how they're sitting, how they're presenting. If it's online, what are we seeing? If it's on the phone, what's the tone of the voice? We're listening intently to the whole of this client, not saying anything, not feeling we have to jump in and keep it running and keep it moving. And that client will naturally start setting the pace.
I couldn't put it better myself, Ken. And I think the idea of us just using the skill of silence as a default skill when we start off with is so important. It's such an underrated skill, because it allows the client to work at their own pace, to move at their own pace, to exercise self-care and protection, because protection is a great big thing in the therapy room, and it's not something that we can always offer completely as therapists. You know, the client themselves has to be involved in their own emotional protection. So the use of silence is a really useful tool, and also be thoughtful on questioning. I've observed some skill sessions. Certainly, my early skill sessions as a student I would have been a better interrogator than a therapist. I was, well, what about this and what about that? And
have you tried this?
Have you tried this? Have you tried that? And you said this before, but now you're saying that. And nowadays, I hardly ever use questions in my practice, only to clarify. So if someone's talking about a complex relationship they're having with a number of people, and they say, well, she said that and he said this, I might say, just so I understand, who is he and who is she? And I think that, I'm sure that benefits and sets the pace, because again, I'm just putting slight interactions in, and then the client is speaking. You know the magic of this, Ken. The absolute magic is you can see that when you're working at the correct pace, the client is putting the pieces together themselves.
Yeah.
That you can see the pennies dropping, and then they might say, so if I did that, that wouldn't happen. And I might use then the skill of reflection and say, so you're saying that you've come up with a different way of approaching it. And if you did that, then what's troubling you may not be the same. And they go, yes. But it is, therapeutic pacing is a skill. And you're right, we live in a society that wants answers, targets, deadlines. And in therapy, we work at someone else's pace. And that can be, I think that can be sometimes frustrating, because some clients move very slowly. And I always used to say to my students, you know, what you consider a very small change might be enormous for the person who sat in front of you. So don't judge any changes or movement by your own frame of reference. It's always their frame of reference.
That's so important. That again goes back to that unconditional positive regard, being in the client's frame of reference. And the word that comes up for me is the word trust. Trusting that the client will find the way. Now, it depends on your modality. If you're working in CBT, you're going to be setting homework, you're going to be working with tried and tested and evidence-based interventions. But if you're working from a person-centered perspective, it's about trusting that the client will find the way. We're not there as the expert to go, so what is it? Okay, that's going on. Oh, well, what you want to be doing there is this and this and this. Let me just get the big red book of counseling answers off my shelf, look up what it is you're presenting with, and tell you exactly what you need to do here. Clients are told all the time by those around them what they should do. Oh, you need to leave him. Oh, you need to stop doing that. Oh, you need to start doing this. They're bombarded with everybody else's opinions on what they should be doing. So often we can find ourselves in a position where we kind of know what we should, and I'm putting that in inverted commas, be doing. However, we just can't bring ourselves to do it, or we keep on breaking our own promises to ourselves. This is what a client is going through. By allowing the patients, bringing the patients, not allowing, bringing the patients into the relationship, the client will find their own way. And when they find their own way, then there is ownership to them. If it's given from an external perspective, we give them the answer, a friend gives them the answer, a partner tells them what you should be doing is, there's no ownership in that. It's when the client is in that place where they go, hold on, I've just had a light bulb moment. That is their own processing kicking in. It never comes from an external place, that those light bulbs. It comes from internal, where something that may have been known for years suddenly makes sense in a different way. There is ownership in that. And that can only come about if the client is given the space to explore, the space to find their own way. And the difficult part is, from the therapist's point of view, extending that trusting the client may find their own way. And one of the things you brought in, Rory, is about that patience, being patient with the client. And it goes back to, what is your default? When I listen to an audiobook, I put it on 1.5 times speed, because the person's not speaking fast enough. I can get through this book quicker and I can get onto the next book. That's me. I'm always moving quickly. But within that professional relationship, the patience, so that the client takes their time and is not working at our pace, so important.
Absolutely, Ken. And I was struck many years ago by a quote from John Schleen, who there's a book. He didn't actually write it. It's a collection of his papers by Pete Saunders, I think, and it's called To Lead an Honourable Life. It's available from PCCS Books. And Schleen was probably the greatest exponent of person-centered therapy. He was a student of Carl Rogers. And he talked about going to a poppy field to watch the poppies open. He'd do it every year to remind himself of the benefit and the power of self-direction. And he'd say he could open the poppies, their leaves were closed, he could see the beauty inside. However, he damaged the leaves. What better way of looking at the beauty and seeing the whole undamaged poppy than watching it open? And he'd go up to the poppy field and he'd watch them slowly open in the sun. And that's a great metaphor for the work we do to not leave our fingerprints on clients in terms of telling them what to do, but to help them unfold themselves and show their inner beauty. And if you want to pick that quote up and the handout that goes with it, the therapeutic pacing, the 4 rules of therapeutic pacing, if you go to counsellingtutor.com, go to podcast episode 202, that handout is there for you. And I think if you are practicing counselling, it's a must-have download. Download it, share it with your classroom buddies, give it to your teacher. They probably have a copy, but give it to your teacher. It's something I used to use in teaching, and I know that Ken's used it as well when we talk together. And it is really, really useful to get a sense of, as I said earlier at the top of the episode, to walk slightly behind the client, exercise patience, and watch the inner beauty unfurl. It's for those of us who practice, it's a wonderful thing.
It is. It's a definite must-have handout. The therapeutic pacing, I think, is something you work on through the arc of your practice. It's not that you get to the point and go, right, well, I've got that sorted now. Every client is going to be different, idiosyncratic in how they appear and how they present. And it's about looking who they are and matching the pace that they set. That patience, really, really important for me personally. So I'm speaking from my perspective, that patience was the key, being patient. You speaking about John Schilling, looking at those poppies, wanting them to open, I can almost see myself sat there going, come on now, hurry up. Yeah, yes. Come on, open up. And if you try, it does nothing. And of course, if you try and open it yourself, you damage it. You can get to the inside, but you're damaging it. You're going to leave your damage on that flower. That patience, and beware of the honey trap. And what I mean by the honey trap is a client can come in session number 1, and they can, in their first kind of presentation, they can mention something about what they are coming for, and they may not retouch on that topic. So I'm going to give an example. They may come and say, I'm here because really struggling. I'm in an abusive relationship and my life is blah, blah, blah. And they can go on with the thing. They may never go back to that abusive relationship, which for us as a therapist, we may go, there's the work. We need to look at that. Well, it's up to the client to rebuild that, not for us in session 3 to go, when you first came in, you mentioned that, because we're setting the pace. We're taking them where we want to go. Trust that the client will bring what they need to bring at the time they need to bring it, and they will find their own way, and be patient within that trust. And most importantly, get the handout. counselingtutor.com, podcast tab, episode 202. Get Rory's super duper download handout. There you have it.
Yeah, absolutely, Ken. And one final thought on therapeutic pacing is just to go back to the analogy of the poppy opening. There is a struggle. Change in anybody is a struggle. And we can empathize with that struggle. We can be there while people struggle. We cannot do the struggle for them. And I think that's part of the discipline of being a therapy and therapeutic pacing, that we cannot take the client's struggle and take it on as our own. We're there to help them make sense of their lives and to make those changes. And some of them will be quite difficult changes. Yep. They may be about, moving on from a partner, changing a job. They may be about sexuality and declaring who they really are and wanting people to know who they really are. And that can be a struggle, and it's a struggle that only the client can undertake. And therapeutic pacing is important so that they can be who they want to be, that process of becoming, at their own pace.